Hey all, how are we? So this one's a bit of an overview, a bit of a rake over the whole cancer story. So in 2010, on Valentine's Day too, mind you, I was admitted to the hospital, the base hospital in Mackay. Yeah, didn't have very good symptoms, pretty terrible, and they didn't know what was going to come of it. There was a specialist flying up from Brisbane, and anyway, story short of that, a month later I was in Townsville. I'd been diagnosed with a rare form of lymphoma. They still don't even have a proper prognosis. The tests went all over the world getting looked at, and they still couldn't come up with a proper prognosis for that. So they did the best of what they could to treat me with that. Anyway, the treatment itself didn't go too badly. The infections, on the other hand, though, totally different story. It's pretty ordinary. And I was very hopeful, and I still today still believe that they all got it wrong. But anyway, the chemotherapy it knocks the crap out of you. It really does, and your immune system, making you very vulnerable to infections. Had a lot of nasty infections, and even today, I do still get like a little bit of anxiety if I've got to stay in hospital for any length of time, because I had a lot of bad memories of infections, and the problem was that the doctors and the nurses, they were awesome. They really were. They did so much, especially on the cancer ward. They are like so good. They really are. And I don't think they get enough thanks for what they do, really. But essentially, you sort of become like a bit of a family in there, and you get really close to a lot of the other patients too, as I did, and you have a lot of conversations with a lot of patients that they wouldn't talk to normal people about, even their family or their closest ones. It's different when you're at that place, because you come both from a place of understanding, and unfortunately, there was a lot of older people that I spoke to as well, and they shared a lot of stuff that they'd never shared with anyone in their lives. And unfortunately, they didn't see many days out after that. But I heard some incredible stories, I really did. Unfortunately, I had a couple of people that were similar age to me, that I got really good with too, on good terms, and a really good friend, and I got to see their family and their kids and things like that, and it was unfortunate when you see them pass too. I had a lot of heavy stuff that didn't so much at that point in time weigh on me, although I sort of just tried my best to not let that get into me, and sort of I knew that the whole cancer thing was a massive psychological thing that you had to like keep positive. But years later, it really started weighing heavy on me, really bad. The why was I so saved, and why did they pass? Unfortunately, one of my mates, he'd recently got married, and his wife was pregnant. I don't even think he got to see his kid born. So that was pretty hard. But like I said, you got to know these people, but I had to try and turn that and flip that around to actually sort of like celebrate the fact that I actually got to know these people, that I actually had a chance to, and we both sort of helped each other along in that last, because sometimes they come to me and they're in a bad place, and I had to prep them up, or sometimes I wasn't so good, which wasn't very often. Quite often I was very hopeful and very positive, but there were times where, it gets you. And that was what it was about. It was about us all keeping each other prepped up, and but I come out of that cancer up in Townsville after a stem cell transplant of my own, with a lot of complications to get there, but we got there. I got a business started, and I just got that off the ground. I had contracts I would have had to employ another man, if not two, and then bang, got cancer again. And they told me if I got it again that things weren't too good, that they didn't think they'd be able to help me. They didn't know how to help me to start with, but they were getting results. But they said, if it come back again, we don't know what we'll do. And wasn't that a rough road? To start with, the treatment wasn't working very well. Within a couple of days, I went from being able to work hard, lay turf and do this and do that, to not even being able to get out of the bed and walk to a toilet that was 12 feet away from me. I'm serious, I couldn't even get up and walk. I was in a really bad place, and after a period of time I managed to get a medication that did slowly start to work, and then I went to Brisbane, And I managed to get into remission. It was a bit of a struggle and a lot of new trial of different drugs, but we got there and went through that. And then what happened after that? I pretty much lost most of my skin, due to complications, and that's when I had nasty infections on my leg. And a person beside me in the room beside me, I listened to the doctors tell him that they were going to take his leg. A couple of days later, they're giving me the same news, and told me that I possibly wouldn't survive, because it was pretty severe. Not a nice place. Not a nice place to be. And I actually got married on the infectious disease ward at the Royal Brisbane Hospital. As soon as I was able to do that, that's what we did. But there was a lot of bad memories there, especially with the infections. The infections were so nasty and saw it all over the place. Within hours, things could just change. You were hopeful, you were looking at maybe getting out, and then bang, it had just changed so dramatically. Anyone that's dealt with cancer would probably know what I'm talking about. Or anyone that's had family members or friends that have gone through cancer, they've probably gone to visit them. This kind of thing happens. And unfortunately, there's so many that don't live. And a lot of it's because of the infections. It can leave people massively scarred, not just on the outside, but deeply inside too. I actually had the pleasure of having Chopper Reed in the room beside me on the infectious disease ward in Royal Brisbane. Yeah, I'll go through a lot more of that, but that's just a bit of a taste. So anyway, it don't have to be great to get started, but you have to get started to be great. Thank you.